We're back with 2020 Democratic presidential candidate and former Maryland Congressman John Delaney. He's been seeking his party's nomination now for almost 2 years. You have been on that trail. I think you declared just 6 months after President Trump was inaugurated. Why do you want to be president?
Well, I think the central issue facing this country is how terribly divided we are and how our government doesn't work anymore, meaning we don't get anything done. And I'm running for president to get America working again so that we can actually fix health care, build infrastructure, improve public education, make sure there's jobs in every community in this country. Those are the reasons I'm running for president. But to do any of those things, we actually have to start coming together. We have to find common ground. We can't act like bipartisan solutions or dirty words that we can't say in Washington anymore.
I think a lot of people would agree with that in principle, but no, in practice, it's a lot harder to get things done, particularly on issues like immigration.
Yes.
So what would you do? Two questions here. Would you decriminalize border crossing? And what would you do with the thousands of migrants who are currently in U.S. custody?
So I wouldn't decriminalize border crossings, but I would make it illegal to separate children from their families. What I would do as president is the two things that we have to focus on.
Would you change the Flores agreement in terms of the limitation on the amount of time children can be held?
Yes, I would. I mean, we have to
You
treat
would allow
children.
them to be detained for longer?
No, I don't want children to be detained long at all. I want to go the other way. We have to treat people who cross our borders with a measure of dignity, right? It has to be reflective of our values. But we should not lose sight of the two things that we have to focus on. We need comprehensive immigration reform. It should have passed in 2013. I think with the right president focusing on this in the first 100 days of an administration, we can get it done. But the other thing we need to do, Margaret, is we need to fix what's going on in those Central American countries. My wife and I, we were down at the border at the beginning of the year. We took 14 law students and 2 law professors for a week and went into the largest detention facility in this country. And what we're doing, we're helping asylum seekers make their case. And when you listen to the stories from these people, you realize that everyone is leaving for the right reason. They feel threatened. Their children are threatened. And unless we do things to rebuild civil society in the 3 Central American countries, we're going to continue to have this refugee crisis. So I've called for something called Plan Central America, which is very similar to something called Plan Colombia that we did a few decades ago, where we actually get all the relevant countries around the table, NGOs that can operate in these countries, and we fix the problem. Because we actually have to focus on that, or we will continue to see a migration kind of refugee crisis at our southern border.
What would you do with the migrants already in U.S. custody, the overcrowding that we are seeing?
Well, we're putting more money there, right, based on the bill that passed this week, which I totally agree with. We need to make our asylum laws more efficient in terms of how these things are processed. We need more asylum judges. We need to enforce our laws.
The administration is arguing for, right?
I know, well, we do need those, right? And we need more facilities. I mean, we have a crisis at the southern border. It's caused by what's happening in those countries. We have to stabilize what's going on in those countries. We have to make sure we have sufficient capacity at the border to handle these individuals. They have to be kind of treated with a measure of dignity. We have to make sure children aren't separated from their parents. And we have to actually apply our laws. But we can't apply our laws unless we have the judges, et cetera, to do it. But this is an example of how broken Washington is, right? Because there are solutions here. There are bipartisan compromises. We actually just saw one this past week, which I thought was a good step forward. We can fix this immigration system that we have in this country. It's broken. We can do things to stabilize what's going on in Central America. But then we can also get to work on the other issues that really matter to the American people, like fixing our healthcare system, lowering pharmaceutical prices, building infrastructure, doing things to improve public education, make college more affordable, expanding, pre-K to make it universal. We also have to focus on these issues.
Healthcare is your signature issue, as I know. And in the last debate, you said Medicare for all is not good policy and it's not good politics. But more than 8 of the candidates, out of the 24 or 25 now, support this. Are voters just being misled by your fellow Democratic candidates?
Yeah, I think they're wrong. I mean, look at so many of the candidates, Senator Warren, so many of these people have outsourced their healthcare plan to Bernie Sanders. Right? Because this is Bernie Sanders' plan. And it'll take private insurance away from more than half of the country. And they will reject that if we run on that. It'll also reduce quality and access in our healthcare system because Medicare doesn't reimburse sufficiently to keep all the hospitals and providers.
You were booed on the debate stage when you raised this, though. So,
I understand that.
So it does seem popular, at least with people who vote in primaries.
But here's the thing. Medicare for all is a great slogan. They've hijacked the good name of Medicare and applied it to a law that will cause upheaval in our healthcare system. And I was the first person to actually talk about this. Now we're seeing the debate change on this issue as people start to realize my plan, which is called Better Care, is a universal healthcare plan. Every single American gets healthcare as a basic right of citizenship for free. But I preserve options. If people want to opt out and keep their private insurance, they can. If they want to buy supplemental plans, they can. It's a much better way to create a universal healthcare system.
And non-citizens?
Non-citizens are not covered by my Medicare plan, but under my immigration reform, they will have legal status while they wait on a path to citizenship, which would allow them to then be covered. See, if you take immigration and healthcare together, you kind of see how we can start solving this problem.
I want to very quickly ask you on foreign policy. You criticized the Obama-era nuclear deal. Iran has said it is now going to break through yet another limit that was set by that deal on their nuclear program. What would you do as commander-in-chief?
Well, I actually voted for the deal. I thought it was imperfect, but I thought it was the right way forward. I would want to get us back in the deal, but I think the deal can be better. Right?
I think you can get back in the deal?
I absolutely think I can get back in the deal,
even
and I absolutely can make it better.
In 2020 and 2023?
That's the problem you got to fix. I think I can get us back in the deal and extend those sunset clauses. I mean, foreign policy really needs to be discussed more in this presidential debate. Things like trade. I was one of the few Democrats to support President Obama with his Trans-Pacific Partnership. I don't think you can run against President Trump unless you supported the Trans-Pacific Partnership. Because rejecting that deal is effectively Trumpian view of the world.
We're going to have to leave it there because I have to take a quick break. Thank you very much.
Thank you, Margaret.